On this Saturday night, slow vaccination in our nation. Pfizer claims it has to cut the doses it's delivering to Canada.
We'll have to make decisions about how best to optimize who gets vaccine.
But the drug company makes a different promise to Europe. The difficult decisions facing ICU doctors in Ontario.
We really have been ground zero for COVID patients in Ontario.
The pressure on intensive care in a province with a high caseload of COVID-19. The barricades are up in D.C. and other U.S. capitals.
I'm sad about it. I have to tell you that it looks that way.
Fortifying America for a safe transition of power.
What will we do with a drunken sailor?
And hooked on old fishing songs.
These songs are sailing across that sea.
The return of the sea shanty.
Global National with Robin Gill.
Good evening and thank you for joining us. Provinces are scrambling to figure out the next steps in their vaccination efforts. Canada was caught off guard when Pfizer-BioNTech cut the number of doses to be delivered to this country. In an effort to ramp up its manufacturing capacity, the drug company says we can expect a 50% reduction over the next 4 weeks. So those who already had their first dose may have to wait longer for the second shot. But as David Akin discovered, the pharmaceutical giant told some European countries the impact for them will be less drastic.
The problem is in Belgium. That's where Pfizer-BioNTech makes all of the vaccines that are shipped to Canada and most European countries. Pfizer-BioNTech needs to upgrade its Belgian plant so it can make more vaccines faster.
This expansion work means that Pfizer is temporarily reducing deliveries to all countries receiving vaccine manufactured at its European facility, and that includes Canada.
Pfizer-BioNTech told Canada and its European customers they would only be getting half as much vaccine as expected for the next 4 weeks. That was where things stood Friday morning. But by late Friday, Pfizer-BioNTech's outraged European customers had won a change, and Pfizer-BioNTech issued a statement saying, "We will be back to the original schedule of deliveries to the European Union beginning the week of January the 25th. But even though Canada gets its vaccines from the same factory as Europe, it wasn't clear if Canada too will be back to regular shipments of Pfizer-BioNTech in 1 week. We are once again in touch with representatives from Pfizer to reiterate firmly the importance for Canada to return to our regular delivery schedule as soon as possible," Procurement Minister Anita Anand said in a statement to Global News. Pfizer assured us that it is deploying all efforts to do just that. Pfizer-BioNTech did not respond to requests for clarification. In any event, any delays in a Pfizer-BioNTech shipment could be a problem for provinces like BC that did not reserve the required second dose for those who have already received their first dose.
We will be looking at how much vaccine is coming in, how many people are due to get their vaccine in that week, or those weeks when we might have less than we're expecting. And then we'll have to make decisions about how best to optimize who gets vaccine at that time.
Canada's chief public health officials say it's okay to give the second dose as much as 42 days later, and that's what Ontario is planning to do for some in that province. In the meantime, the rollout of the Moderna vaccine should continue uninterrupted. Canada received 171,000 doses of that vaccine this week and is expecting 230,000 more Moderna doses in the first week of February. David Akin, Global News, Ottawa.
Ontario's COVID-19 caseload increased by more than 3,000 new infections today. That's 11 straight days of numbers that high. There are fears the province's intensive care units will soon be pushed to the brink, especially in the Greater Toronto area. As Morganne Campbell reports, some patients are being flown out of the GTA as ICUs become overloaded.
A surge in the number of COVID-19 positive patients in need of critical care is putting an intense strain on Ontario's healthcare system, already under immense pressure.
I didn't think I would ever be in a situation where we would be transferring patients to other hospitals for admission transport to the ICU or transferring patients to other neighboring cities.
Lisa Solomon is an emergency room physician with the Scarborough Health Network, where many doctors are worried about capacity issues in the intensive care units.
We're seeing really sick patients with COVID, and in addition, we're seeing really sick patients in general with other presenting issues.
Friday, the Health Network admitted its 300th patient to the ICU. The lack of space has forced doctors to send some of those patients to Kingston General Hospital for treatment, nearly 3 hours away.
When the word came out that we would likely get patients from out of area, the government has asked us to reserve about a third of our existing open capacity.
Kingston General Hospital has recently expanded its capacity for ICU beds. Earlier this month, the province asked hospital CEOs to prepare for out-of-region patients and to share resources with hospitals overwhelmed by the virus. Hospitals were also directed to accept any patient transfers. This practice is common, dating back well before the pandemic, but doctors say not to the extent they are experiencing right now.
As they try and sort of share the responsibility of caring for these patients across the province, the closer hospitals get filled up sooner, and then you start to look to sending them to places that are maybe less affected and have a little bit more capacity at the time.
Provincial modeling shows ICU admissions could exceed 1,000 in less than a month, which means these patient transfers will likely continue. Morganne Campbell, Global News, Toronto.
Inspectors have begun a blitz on big box stores in Ontario to make sure staff and customers are sticking to public health measures. The inspectors are looking to make sure people are wearing masks and maintaining physical distancing. If they break the rules, they face fines up to $750. Inspectors also have the authority to disperse groups of more than 5 people and shut down stores that breach the rules. Just days before President-elect Joe Biden's inauguration, police in Washington have arrested a Virginia man trying to get through a checkpoint near the Capitol building. A 31-year-old was found with fake inaugural credentials, a loaded handgun, and more than 500 rounds of ammunition. It's tense in the U.S. Capitol after the riots earlier this month, and now tens of thousands of soldiers are patrolling the streets of D.C. Here's Jennifer Johnson.
National Guard troops from Washington State are heading to Washington, D.C. as federal agencies order more troops deployed to protect the nation's capital ahead of Inauguration Day.
Our troops are going there to support and defend the Constitution of the United States against all enemies, foreign and domestic.
Washington, D.C. looks like a war zone with at least 25,000 soldiers patrolling the city. The Coast Guard is battle ready on the Potomac River. Miles of fencing and barbed wire surround the Capitol.
God bless you all and keep you safe. And may God protect our troops. Thank you.
Just days before he will be sworn into office,
yes,
President-elect Biden answered yes after being asked if he still felt safe. But Sunday's inauguration dress rehearsal has been canceled. The day will be like no other. For the first time in U.S. history, the National Mall, where hundreds of thousands of people usually watch the event, will be closed. Most metro rail lines have been stopped. Airbnb has canceled all D.C. reservations. Every street leading into the Capitol is barricaded.
I'm sad about it. I have to tell you that it looks that way. I'm committed to making sure that we get our city back.
As part of Inauguration Day festivities, the Canadian Embassy usually hosts a celebration for foreign dignitaries. That too has been canceled due to the pandemic and security concerns. Many D.C. residents are worried.
I don't know what to expect other than I'm just afraid someone or many people are going to get killed.
President Trump is refusing to abide by tradition and will skip the inauguration. As staff starts to move out, the president remains quiet at the White House ahead of his Wednesday morning departure. Aides are considering an elaborate send-off with a red carpet, military band, and 21-gun salute. Jennifer Johnson, Global News, Washington.
Security is ramping up right across the U.S. tonight. The FBI warns Trump supporters may target all 50 state capitals on Wednesday, and preparations are underway for potential armed protest as early as tomorrow. Tonight, Mike Armstrong is in Harrisburg, Pennsylvania, and as he explains, no one wants to be caught off guard again.
There isn't a whole lot to see from the street outside the Pennsylvania State Capitol complex. Barriers and not a whole lot else. But behind the scenes, it's all hands on deck. Capitol Police, City Police, State Police, and the National Guard all are preparing for Sunday.
We are not issuing any permits, so there are no protests scheduled here.
There are no specific threats against Harrisburg or any other state capital, but there have been flyers circulating online suggesting protesters who can't make it to Washington Sunday go instead to their state capital. Since the January 6th siege in Washington and the arrests that followed, the calls to arms online have died down. Authorities fear that could just be protest planners being more secretive and careful online.
Let's go! I think that's why some of the chatter has stopped. I think that's why some of the platforms have changed. Right now, it's a chess game.
Literally from coast to coast, state capitals are preparing. From Lansing, Michigan to Sacramento, California, from Austin in Texas to Tallahassee in Florida. Again, there are no specific threats, but America is on alert in case.
Now, I am hopeful that we do not experience any violence in the capital city this weekend or next. But hope is not a plan.
The protection outside the capitals is only a part of what's going on. The FBI is collecting intelligence, whatever it can find, and sharing it with local and state police.
The intelligence is key. You want to have the ability to develop a plan, but you also want to have as much knowledge about the intent and capability of the people that are going to show up.
One thing that does have police nervous is a line in this flyer calling it an armed march, telling people to show up with weapons. In an open carry state like here in Pennsylvania, police admit that does make things more delicate, but they say they have the training and Sunday they'll have the numbers to deal with anything. Robin?
Mike Armstrong in Pennsylvania tonight. Thanks, Mike. Canada will have a representative at the inauguration. The two countries have long been allies, but the last 4 years have been tense. So our relationship with the new administration will be very important. Abigail Beeman spoke with Canada's ambassador to the U.S., Kirsten Hillman, on the West Block. Abigail.
Robin, in an inauguration like no other with beefed up security and in the middle of a pandemic, Ambassador Kirsten Hillman says she will be there in person. All attendees will be getting a COVID-19 test first. But in terms of the actual work she has in front of her after the ceremony, getting the Biden administration's attention for Canada could be a challenge after the chaos of a transition to power like no other. Ambassador Hillman says conversations are already underway.
Reaching out and getting into the Biden executive team was going to be very important to us. We have been spending months getting ready for that. The Biden team themselves, the appointees and the nominees, have been very respectful of the fact that there's only one U.S. administration at a time, and it remains the Trump administration until Wednesday at noon. But we have been able to talk to many members of their transition team and people that are advising them to start to lay the groundwork for those first calls and that first outreach.
I also asked the ambassador how she'll push Canada's interests on files that clash with the incoming president's agenda, such as the Keystone XL pipeline. Hillman says she will have honest and fact-based conversations. You can catch her entire answer and the full interview Sunday on the West Block. Robin?
Abigail Beeman in Ottawa. Thanks, Abigail. Global News will have live coverage of the inauguration from Washington, D.C. on Wednesday morning at 11 Eastern, 8 Pacific. Coming up, the world's largest vaccination campaign begins in India. And Uganda's long-serving president hangs on to power. The search for survivors continues in Indonesia. Friday's 6.2 magnitude earthquake on the island of Sulawesi injured hundreds of people and killed at least 49. The death toll is expected to grow as rescue teams dig through the debris. Damaged roads, power blackouts, and a lack of heavy equipment are hampering their efforts. Nearly 15,000 people have been displaced by the quake, and they're desperate for shelter and supplies. Mount Semeru, Indonesia's highest volcano on the island of Java, spewed hot clouds into the sky. There were no evacuations or reported injuries. After weeks of violence, Uganda's longtime president Yoweri Museveni has secured his 6th term in office. His supporters celebrated in the streets. The 76-year-old won 59% of the vote, but his rival, a musician turned politician known as Bobby Wine, claims the election was rigged. The opposition leader remains under heavy guard, and his party says he's effectively under house arrest. In the lead up to the vote, dozens were killed and the country's internet was shut down. Museveni has been in power for 35 years. He's been accused of ordering violent crackdowns to silence critics. In the UK, a cathedral has been transformed into a vaccination center. In the Middle Ages, sick people would go on a pilgrimage to this cathedral in the hopes of being healed. Now hundreds of people are passing through its doors to receive the COVID-19 vaccine. This is just one of several major buildings in England repurposed for the vaccine rollout. The UK government hopes to vaccinate about 14 million people by February 15th. India has kicked off what's expected to be the world's largest COVID-19 vaccination campaign. More than 150,000 frontline healthcare workers received the vaccine today. The government hopes to give the vaccine to 300 million people by July. To put that into context, that's roughly 8 times the population of Canada. Still ahead, the experts weigh in on whether COVID-19 patients need to get vaccinated. For nearly a year now, Global News has been taking your COVID-19 questions straight to doctors. They've tackled countless topics, including how the virus is transmitted, mask use, and how Canadians can keep themselves safe. Tonight, Jeff Semple takes more of your questions to the experts.
Why does Zane always wear a jacket and make us look bad, huh, Isaac?
For months now, these 4 friends and infectious disease doctors have been answering viewer questions about COVID-19. And a lot of the questions lately are focused on vaccines.
Hi, I'm Lori from Calgary. My question is, if someone has had COVID and they've recovered, do they still need to get vaccinated?
Right now, we know that people who are exposed to the virus do develop some type of immunity. How long it lasts, how good it is, and how effective it is at preventing reinfection if you run into this virus again is not quite clear. And so the take-home message and best advice right now is that even if you've had COVID-19 before, please get your vaccine.
Hi, my name is Elsa Holland. I live in Yoho, New Brunswick. I currently receive treatments for breast cancer. Has the vaccine been tested on people taking cancer treatments that suppress their immune systems?
And we've received a lot of questions like that from people who are immunocompromised, obese, or have pre-existing health conditions and are wondering if the vaccine will be safe for them. Dr. Chagla?
So these are done in clinical trials with relatively healthy people. There were people with, a small number with HIV, a small number with obesity, a small number with diabetes and high blood pressure that were incorporated into these studies. And, not enough to say that there's any big difference, but certainly there wasn't any difference that was seen in those responses amongst those individuals.
My question today is about hand washing. In this new phase of the pandemic, we don't hear anything about hand washing anymore.
I think as time went on and we learned more, it became more apparent that getting COVID from surfaces where it's not impossible to do so, I think the big risk to know is that COVID is spread primarily in indoor settings when you're in a enclosed space, especially with poor ventilation and for a prolonged period of time. You're not really going to get it by touching a shopping cart, going to get groceries. Hey, love you guys. I got to go. Bye.
Yeah. Thanks, everybody.
Bye.
After yet another round of COVID-19 questions, it's back to yet another day on the front lines of the pandemic. Jeff Semple, Global News, Mississauga, Ontario.
What's your favorite sea shanty?
There once was a ship that put to sea.
Up next, the old sea songs that have the world on board.
Hey, everybody, welcome back. Let's say hello to our friend, Mr. John Baptiste. John, are you aware that 2021 is the year of the sea shanty? Oh, my goodness. It's the year of the sea shanty? Really? I can't believe.
Even Stephen Colbert is talking about sea shanties. These folk songs date back hundreds of years. Sailors would sing them while working through rough conditions. Well, the tunes have made a comeback. They've brought people together in these modern troubled times. Here's Ross Lord.
On this popular social media platform, people are breathing new life into old fishing songs known as sea shanties.
Soon may the whaleman come to bring us sugar and tea and rum.
Sea shanty remakes are getting millions of views, reviving interest in songs created centuries ago.
What will we do with a drunken sailor? What will we do with a drunken sailor?
Sea shanties have always gone hand in hand with hardship.
Show me the way to go home. I'm tired and I want to go to bed.
A way for sailors to get the job done in bitter working conditions using different rhythms for different jobs.
Use a sheet shanty like Whiskey Johnny. Oh, whiskey is the life of man. Whiskey Johnny. So those quick pulls, that'll pull that sheet in and you'll get the sail trimmed.
Their resurrection at the height of the COVID-19 pandemic is no coincidence, according to some folk historians.
I think people need things to lighten up a bit. So they need a bit more enjoyment, something that they can get into.
And something to help them get through tough times, according to Sean McCann. As a singer-songwriter and former member of the Newfoundland folk group Great Big Sea, McCann's nickname was the Shanty Man.
There's a sea of social media, and but it's still, these songs are sailing across that sea. They're just doing it really fast.
How long this infatuation lasts is anyone's guess, but for those who've invested most of their lives in sea shanties, seeing that passion shared by millions of others is heartwarming.
So give a sailor not your heart, less sorrow you do seek. Let true love not be torn apart by favors from the sea. Stay calm, shanty on.
Ross Lord, Global News.
Shanty on. That is Global National for this Saturday. I'm Robin Gill. Tonight, your Canada is Bowness Park in Calgary. Thank you for watching, and I'll see you back here tomorrow. Have a great night.